Okay, I'm ready to do my head to toe assessment, and here is my rubric that's not written at all, nothing on it. Blank. Now I'm gonna go ahead and start my assessment.
Hello.
Hi, my name is Gloria Kivanga. I'll be a student nurse, and I'm from Saginaw Valley State University. I'm just basically gonna be doing a head to toe assessment on you today. So I'm just gonna ask you a couple questions. If you're just gonna openly answer me, that would be much appreciated. Do you please mind telling me your name and date of birth?
My name is Sandra Ndurango. My date of birth is 10/7/2003.
Okay, and do you know where you are right now?
Yes, Campus Village Apartments,
Okay, do you know what year this is?
2025.
Okay, you are oriented times 3, that's a good thing. And also, I would like to know if you have any allergies.
No,
You don't have any allergies, right? Okay, are you currently on any medications?
no,
Nothing? Okay, and are you currently diagnosed with anything? Like, I need to know your medical diagnosis history, either currently or your previous history. Do you have any?
no,
Okay, and have you had any procedures performed on you before or currently?
no,
None? Okay, how about your family history? Is there any type of disease that I should be knowing about? Maybe heart diseases or blood pressures, things like that that run in your family?
no,
None at all? Okay, that's a good thing. So, do you take any you told me you're not on any medications, right? Okay, how about supplements or herbals or things like that? Are you on any so far?
no.
None? Okay, so do you mind telling me how your diet is like?
So I try to eat a balanced diet for every meal, and then I include fruits and vegetables in my meals.
Okay, and do you consume, like, I would say if a plate is 100%, what percent do you think you take from your whole plate when you eat your food?
More than 90%.
More than 90? Okay, and you get like 3 meals a day, or you just have options for meals that you prefer?
I take 3 meals a day.
Okay, that's good. And how about your activity levels? How often do you exercise?
I try to exercise every day for 30 to 45 minutes.
Okay, what type of exercises do you do?
I do running, cycling, and walking.
Okay, and have you experienced any shortness of breath or pain in your muscles or weakness when you do exercise?
No.
Everything seems to be working fine. Okay, also, do you drink?
No.
Okay, how about smoking? When I ask about smoking, I also include vaping and things like cigar, marijuana, or weed, or anything like that.
No.
You don't?
Mm.
Okay, so far, I think I've asked you the most important questions, but I'll keep asking you as we proceed. And for today, do you feel any pain? Like, are you in any pain in any of your body parts, or
No.
you're not in pain?
No.
Okay, that's a good thing. So I'm just gonna go ahead and do your vital signs. Do you have an arm that you prefer for me to take your vitals?
No.
Okay. If you just give me your left hand. This might be uncomfortable for a while, but I'll try to be quick, not to make you feel the comfort. Okay, your blood pressure is 128/82. That's not too bad. It's within a good range. Okay, so now I'm just gonna go ahead and take your pulse. I would need you to stretch your arms like this. So I'm gonna take your radial pulse for a full minute. Okay, your pulse is 78. There's nothing for me to be worried about. I will always want it to be 60 to 100, so that's good. And also, while I was doing that, I was taking your respirations. Your respirations are 16. That's a good thing to. I want them to be around 12 to 20, so that's a good sign. And I'm also gonna check your fingers for any signs of clubbing. Your fingernails, okay. I don't see any signs of clubbing. That shows you're not oxygen deprivated. I'm gonna check for capillary refill. Comes back less than 3 seconds. That's good. Yeah, comes back less than 3 seconds. That shows your tissues are perfused. That's a good sign. So I don't have an oximeter with me, but if I had it, I would have to check your oxygen. But so far, I can see you're not using your accessory muscles to breathe, and your capillary refill and clubbing. You don't show any signs of clubbing, so I would estimate you have a good oxygen saturation. There's nothing to be worried about there. And so I also don't have a thermometer with me, so I'll just be checking your temperature throughout your body as I go. But as of right now, I can see your temperature is just not too bad. It's good. So I'm just gonna go ahead and check your pulses for symmetry and strength in both your radial and brachial pulse. So I'll start with the radial pulse. They're strong and symmetrical. I'm gonna check your brachials. They're strong and symmetrical. So now I'm also gonna proceed and just do an assessment on your arms. That includes your skin and everything. So just gonna do this. Your skin tone looks good. You have a couple moles. Have you ever noticed having these moles before?
Yes.
Okay, and have you ever noticed maybe irregular shapes or change in color?
No.
Okay, as I'm palpating, do you feel any pain?
No.
Okay, I don't sense any tenderness or swelling either. Your temperature seems to be fine in your arms. Okay, how about this other arm? Your skin color seems to be good. Temperature is good. I also notice a couple moles, but they're all similar to the one you had in your other arm. Do you feel any pain as I do this?
No.
Okay, your temperature seems to be working fine as well. So now I'm just going to go ahead and do a range of motion and your muscle strength test for your arms. If you just help me do this, your arms inwards, okay, outwards. Okay, just do some lifting, like heavy lifting for your biceps. Okay, this seems to be working fine. So just put your arms out like this. I'm gonna push you down, try to push me up. Okay, the opposite now. Okay, put my hands in, and then I'm gonna push you out, push me in. I'll push you in, push me out. That's good. Okay, do you wanna pull me in? Push me out. Okay, that seems to be working fine so far. Okay, so I'm also gonna go ahead and test your cerebral function. I just wanna flap you. I want you to flap your hands on your thighs, open them, do it as fast as possible. Okay, that's good. If you wanna do the okay sign for me in every finger, okay, do it as fast. Okay, that's good. So now I'm gonna go ahead and assess for your cranial nerve 11, that's your spinal accessory. I'm just gonna put my arms against your shoulder. You have to shrug it. One more time. Okay, that seems to be good. You wanna give me a swimming motion from the front. Okay, backwards. Okay, that all seems to be working fine. So there's nothing to be worried about. Your muscle strength and your range of motion in the arms is all good. So now I'm just gonna go ahead and inspect your head. So do you have any history maybe of dry scalp or itching or dandruff?
No.
None at all?
No.
Okay, is there any shampoo that you're using for your skin, like your head?
Yes.
Okay. So as I'm palpating, do you feel any pain?
No.
Okay. I can't feel any tenderness either. I can't feel any swelling. Your occipital seems to be fine. Your temperature is good. So far, everything seems to be fine in your head. And yeah, your face looks symmetrical. That's a good thing. So now I'm just gonna go ahead and start your assessment on the face. That includes your eyes, mouth, nose, stuff like that. So do you have any acne history or pimples? Have you ever struggled with that?
No.
Okay, I don't see any so far. I also see a couple moles on your face. Have you ever kept track of these? How long you've had them?
Since I was young.
Okay, you've not noticed anything like changing shape or color?
No.
Okay, they look fine. Your temperature is also good on your face. So now I'm just gonna go ahead and go ahead and have you close your eyes. I'm gonna do, this is gonna be me assessing for your cranial 5, your trigeminal, the sensory part of this. I'm just gonna tap some parts of your body and some parts of your face and then tell me where I tapped, okay?
Forehead, left cheek, right cheek, chin, nose.
Okay, your trigeminal sensory part seems to be working fine. Now I'm gonna go ahead and touch your jaws. I want you to crunch them for me. Okay, they seem to be working good. Do you wanna raise your eyebrows for me? Okay, seems to be working fine. So before I also proceed, I'm just gonna go ahead and finish with your first show nerve. That's nerve 7. I'm gonna want you to make a couple faces for me. I'm gonna want you to smile. Could you frown? Okay, everything seems to be working fine for your first show nerve 7. Okay, so now I'm just gonna go ahead and start assessing your eyes. So far I see your eyebrows look good, your eyelids, everything looks symmetrical. Do you have any problems with sight vision, like seeing farther or closer? Do you
No.
wear a contact lens?
No.
How about glasses?
No.
Do you have any, I would say, sensitivity to light?
No.
None at all? Okay, so now I'm gonna go ahead and assess your eyes. Do you wanna look up? Okay, look down. Look up. I'm sorry, look down, Look down, thank you. Look up. Okay, your sclerola is white. That's something that I would want. That looks good. And your conjunctiva looks good, pink and moist. That's a good thing. So now I'm gonna go ahead and proceed with my eye test for you. I'm gonna go ahead and just assess for cranial nerve 3. That's your oculomotor. I'm gonna flash my light in your eyes. Just want you to look straight. This is the parasympathetic part of the cranial nerve 3, the oculomotor. Okay. Okay. So far, your pupils were reactive to light. They are round and they're actually equal in size. That's a good thing. They constricted so well to light. That's a good thing and something that I want to see. So I'm just gonna go ahead now and test for your cranial nerve 3, 4, and 6. That's include your. It's gonna include your trochlea, your oculomotor as nerve 3, your trochlea, and then your abducens. With that, I'm just gonna use the 6 cardinal fields of gaze. I want you to follow my pen light with your eyes and not your face. Okay, that seems to be working fine. So now I'm gonna check for your corneal light reflex. I'm just gonna flash my light on your nose. Just look straight. Okay, your pupil seems to be working fine. They constricted well and they react well to light. That's a good sign. I'm also gonna have to check for accommodation of your eyes. So with your accommodation, I'm gonna put my hands right here and my pen light. So you're gonna look at my pen light and then I'm gonna look at my hand, okay? Pen light, hand, pen light, hand, pen light, hand. Okay, your eyes seems to be accommodating fine. So I'm gonna check for coordination now. I'm gonna have you touch your nose and then you're gonna touch my pen light, okay? Touch your nose, my pen light. Your nose, my pen light. Your nose, my pen light. Okay, so far everything in your eyes seems to be working fine. I wouldn't be worried about nothing and you've been seeing clearly so far. If I had the Snelling chart, I would also assess for your cranial nerve 2, that's your optic nerve. But since I don't have it and you've been seeing everything visually, you seem to be working fine. That's good. And I'm also going to ask you, like, do you regularly do eye exams?
No.
You don't? Okay. That's something that I would just recommend for you to do at least once a year. If you want to see a doctor and just check your eyes, that's going to help to keep your eyes in shape and make them, like, see for as long as you survive, you know? Okay. So now I'm done with your eyes. I'm going to go ahead and assess your nose. Do you have any sensitivity to smell?
No.
Allergies when it comes to smelling something?
No.
Nothing at all? Okay, so I'm gonna have you breathe in. I'm gonna hold this, breathe in, breathe out, Okay, you did that. Breathe in, breathe out. Okay, that seems to be working fine. So I'm gonna flash my pen light in your nose. Okay, your septum doesn't show any signs of deviation so far, and I don't see any polypsy. Your nose is moist and pink. That's a good thing. That's something that I would want, so I don't have to worry about anything. So right now I'm gonna have you close your eyes, and I'm gonna test for your cranial nerve 1, olfactory nerve. You're gonna have to smell this and tell me what you smell.
Ginger.
Okay, that's good. You got it right. So your olfactory nerve seems to be working fine. That's a good sign. So now I'm done with your nose. I'm just going to go ahead and assess your mouth. Your lips are symmetrical. They look good. I don't see any signs of lack of oxygen. They're pink. Their color is good. You don't have blue lips and all that. So do you mind if you just open your mouth for me? Okay. I'm going to flash my light. Could you show me your gums? Just crunch your teeth together. Okay, I don't see any signs of bleeding in your gums. That's good. Your mouth is moist. I can see saliva. So now I'm just gonna go ahead and assess for my cranial nerve 9 and 10. That's the glossopharyngeal and the vagus nerve. I'll have you open your mouth. I'm gonna press your tongue and you're gonna say ah. Okay, say ah. Okay, that's good. Your uvula and the soft palate did rise. That's a good thing. Shows you have a good gag reflex. And I'm also gonna have to assess for your cranial nerve 12. That's your hypoglossal nerve. I'm gonna want you to pull out your tongue. Could you take it sideways, left and right? Okay. Your hypoglossal nerve seems also to be working fine. That's a good thing. So now, before I go further ahead, I'm just gonna go ahead and assess your ears. Your skin color on your ears is good. I don't see anything that should be making me worried. I also note you have some piercing. Have you ever had, how long have you had this?
Since I was 3.
Okay. Do you have any infections or the healing process, or is it just good?
Yeah.
Do you have any difficulties?
No.
Nothing at all?
No.
Okay. So your ears look fine, inside out, and the back of your ears are good. The temperature is good. So now I'm just gonna go ahead and palpate your ears. Tell me if you feel any pain. No pain at all?
No.
Okay. I don't sense any swelling either. So now I'm just gonna go ahead and pull your ear up and out. Okay, I don't see any falling objects or obstructions in your ear. I'm gonna go to the other one. Pull up and out. I'm gonna pull your pinna up and out. Yeah, I don't see any foreign objects. And do you hear me well?
Yes.
Okay. So far, I'm not done with your ear first. I'll just finish this at the end. That's for your cranial nerve 8. I'll just go ahead and finish at the end when I do my other tests about the earring and the balance and equilibrium. So as of right now, I'm just gonna go ahead and assess your sinuses. I'm gonna palpate your sinuses. So tell me if you feel any pain. Your frontal sinuses. Do you feel any pain?
No.
Okay, I don't feel any swelling either or lump. Your maxillary, do you feel any pain?
No.
Okay, I don't feel any swelling. That's good. So now we're just gonna go ahead and feel for your lymph nodes. I want them to be non-palpable, so you're just gonna tell me if you feel any pain as I assess them, as I palpate, okay? So I'm gonna start with your pre-auricular lymph nodes. Do you feel any pain?
No.
None at all. Okay, your post-auricular, do you feel any pain?
No.
Okay, they're all non-palpable. I wouldn't be worried. Okay, your cervical shin, non-palpable. Do you feel any pain?
No.
Not at all. Okay, your submental, do you feel any pain?
No.
Okay, they're also non-palpable. Your submandibular, do you feel any pain?
No.
Okay, they're also non-palpable. I'm gonna do your occipitons. Do you feel any pain?
No.
I also see non-palpable, and I'm gonna do your supraclaviculars. Do you wanna put your shoulders close for me? Do you feel any pain?
No.
Okay, I also don't feel any, they're non-palpable. That's something that I want. I'm just gonna go ahead and also test for your skin tagger. Just wanna put your shoulder close there. I don't see any signs of tenting, so that shows you're well hydrated. There's nothing to be worried about. So far, your lymph nodes are all good. They're non-palpable. That's something that I want to see. In case they would be palpable, I would want them to be soft and movable. But if they would be hard, that would be a sign of malignant or infections that would somehow bring a concern. So far, everything seems to be working fine. So now I'm just gonna go ahead and assess your trachea for symmetry. If you just do this for me. Are you feeling any pain?
No.
Okay, your trachea is symmetrical. That's good. So I'm just gonna go ahead now and assess for your thyroid. Gonna have to push your trachea a bit and then pull. Okay, can you swallow? Do you feel any pain?
No.
Okay, let me take this other side for your thyroid. Can you swallow? Do you feel any pain?
No.
Okay, so now I'm just gonna go ahead and assess your carotid arteries. I'm just gonna auscultate first to hear if there's any bruit, and for this I'm just gonna listen with my bell. Okay, I'm gonna engage my bell one at a time. Excuse me, I don't hear any bruit. I don't hear any bruise. So now I'm gonna go ahead and palpate your carotid one at a time. Okay, this seems to be working fine. Gonna go to this side. Everything seems to be good there as well. So yeah, now I'm just gonna go ahead and start with your lungs. Okay, I'm gonna untie this, I'm sorry. And for your lungs, I'm gonna listen to 12 spots. I want to hear clear lung sounds. And I'll be using my diaphragm for that. So I'll open this if you don't mind. Open your bra. I'll close it back. Okay. So now I'm gonna have you breathe in for me because I need to check for your lung expansion and symmetry. And so far on your skin, there's a good temperature, nothing to be worried about. I see a couple moles. Have you ever kept track of these?
Yes.
Okay, do they have any issues? Like, have you noticed any change of shape or color?
No.
Okay, yeah, they have the same shape. They don't look weird, so there's nothing to be worried there. So would you take a deep breath for me? I'm sorry about my hand. Okay, right there. Take a deep breath. Okay, I would say the bases of your lungs are right there because my hands did expand when you took your breath. So now as I move my my diaphragm, I want you to take a breath, but then if you feel uncomfortable, you're gonna raise your hand and then you're gonna pause and we'll continue, okay? Okay. I'm gonna listen to 12 spots. Breathe in, breathe out. Breathe in, breathe out. That's your first spot. Breathe in, breathe out. I hear clear lung sound. Breathe in, breathe out. Breathe in, breathe out. In, out. Your fourth spot. In, out. In, out. Your fifth. In, out. In, your final. In, out. In, out. So far your lung sounds are clear. Now I'm gonna go ahead and percuss. All I want to hear is resonance. So if I hear any dullness, that will be a sign of fluid in your lungs. I don't want to hear any dullness. I'm gonna do the same 12 spots. Okay, there's nothing abnormal there. I had resonance. That's what I wanted to hear. I didn't hear any signs of dullness that would indicate fluid in your lungs, and that would make me worry. Okay, so far, I'm just gonna close this. And do you feel any dizziness so far? Do you feel good? Do you think you can lay in bed?
Yeah.
Okay. Just gonna have you lay in bed now. Okay, so before I start anything, I'm just gonna check for your jugular vein distension. I'm gonna take your pillow away from you. It's gonna be uncomfortable for a bit. Okay, I'm gonna have you turn over the other side. Okay, I don't see any distension of your jugular vein this side. Okay, I don't see any signs, but if I did, I would have to I would have to wake you up for at least an angle of 30 to 45 to just see, and in case I did see any distension, I'll be worried for fluid overload. Okay, so now I'm just gonna go ahead and listen to your heart valves. Okay, we tied this, now I'm gonna tie again, sorry. Okay, for your heart valves, I'm gonna listen at 5 spots. I'm gonna listen to 5 spots, and for each, I'm gonna use my diaphragm and bell. For diaphragm, I'll want to be hearing lab dab, and for my bell, I'll just be checking for any signs of murmurs, if I can hear any murmurs. So I'll start with the aortic valve, that's on your right second intercostal space. Okay, so now I'm gonna go clavicle space, first rib, first intercostal space, second rib, second intercostal space, right there. I'm gonna listen for lab dab. Okay, that's good. That's your aortic valve. I'm gonna engage my bell now and listen if I can hear any murmurs. I don't hear any murmurs. Okay, now I'm gonna go ahead and listen to your pulmonic valve. So it's gonna be on your second left intercostal space. So clavicular space, your first rib, your first intercostal space, your second rib, then your second intercostal space right there. I'm gonna listen for lab dab. That's your pulmonary valve. Okay, I can hear that. So now I'm just gonna go ahead and engage my bell and listen for any murmurs. I didn't hear any murmurs. So now I'm just gonna go ahead and listen to your Erb's point. That's gonna be on your third intercostal space. So now it's gonna be your third rib, your third intercostal space right there. Gonna listen for lab dab. That's your loudest point. Oh, I can actually hear that. Okay, now I'm gonna engage my bell and listen if I can hear any murmurs. There. I don't hear any murmurs. Now I'm gonna go ahead and listen to your tricuspid valve. That's gonna be on your fourth intercostal space. So that's your fourth rib. That's your fourth intercostal space right there. I'm gonna listen for lab dab. Okay, I can hear your lab dabs. I'm just gonna go ahead and engage my bell and listen for any signs of murmurs. I don't hear any murmurs. Now I'm just gonna go ahead and listen to your mitral valve. That's the most accurate. Okay, so it's on your fifth intercostal space. So that's your fourth. Then that's gonna be your fifth rib. That's gonna be your fifth intercostal space right there. So this is lined mid subclavicular, like on your clavicle, it's lined on the midline. So I'm gonna have to do that. So it should be around here. I'm gonna listen for lap dab, and then I'll listen for murmurs. So lap dab with my diaphragm. Oh, okay. Now I'm gonna engage and listen for any murmurs. I don't hear any murmurs. Now I'm gonna also have to again listen with my diaphragm for a whole minute for my apical pars. Okay, that worked. Okay, that was 78 beats. That's good, nothing abnormal there. Okay, so now I'm done with your heart valves. I'm just gonna go ahead and assess your abdomen. Do you want me to take it from up here? Do you want me to cover your feet?
Yes.
Okay. I'm gonna cover your feet. I'm gonna assess your abdomen. Okay, so I'm gonna inspect first. I also see like on your abdomen, your skin looks good. Your temperature is okay. There's nothing to be worried. I don't see any abnormal things here. So from the side, okay. I can see your aortic valve. I can see your aortic artery pulsations. That's a good thing, and I don't see any swelling or bumps. And now I'm gonna also ask you these questions. Are you incontinent in anything? Do you go to the bathroom, or are you able to control like?
Yes.
You're okay. So you're not incontinent.
No.
Okay. And when was the last time you used the bathroom?
An hour ago.
Okay. So now I'm just gonna go ahead and auscultate. Auscultate or 4 quadrants on your abdomen. I'll start with the right lower quadrant. Okay. I'm going to be listening for vowel sounds. There should be at least 5 to 30. Oh, I can hear them. Okay, I'm going to go to your right upper quadrant. I can hear them. I'm going to go to your left upper quadrant. You can hear them. Your left lower quadrant. I can hear your vowel sounds. So now I'm just gonna go ahead and listen to your arteries, and I would use my bell for here because I want to see if I can hear any bruise. So I'll start with your aortic artery. I'll have to look for your sternum right there, and your umbilicus. Let me actually engage my bell before. Okay, your sternum and your umbilicus, it should meet in the middle right there. So I'm gonna listen to your aortic artery, your abdominal aortic artery. I don't hear any bruise. Now I'm gonna go ahead and listen to your right renal artery down here. I don't hear any bruise. I'm gonna go ahead and listen to your left renal artery. don't hear any bruise. Now I'm gonna go ahead and listen to your iliac artery that's above your crest but below your umbilicus, right there. For the left, I don't hear any bruise, and then for the right side, I don't hear any bruise. That's good. So now I'm just gonna go ahead and I'm gonna palpate your femoral arteries. So could you just open your legs up for me? Thank you. I'm right here. Okay, I'm gonna check for symmetry on both of them right here. Okay, they're symmetrical and strong. That's good. Now I'm gonna have to listen for any bruise. I don't hear any bruise in your femoral arteries on the other side. I don't hear any bruise. That's a good thing. So now I'm just gonna go ahead and also percuss your 4 quadrants. I need to be hearing tympani. If I hear any dullness, that would be a sign of like I would say an organ inside or anything that shouldn't be heard in that part. So I need to be hearing tympani in all your 4 quadrants. So I'm going to start with your right lower quadrant as usual. Okay, your right upper. Can hear tympani. Your left upper. Can hear tympani. Your left lower. I can hear tympani. Now I'm gonna go ahead and look for the border of your liver. Okay, I start hearing dullness there. So your liver's border is around here, around this place. That's where your liver starts. Okay, so now I'm just gonna go ahead and palpate. I'll start with light palpations and then I'm gonna go with your deep palpations. I'm just gonna look at your face if you're grimacing, and in case you feel any pain, just let me know. Do you feel any pain there on your right lower quadrant? No, you don't. How about right there?
No.
Don't. Okay. How about right there?
No.
Don't. How about right there?
No.
Okay, now I'm gonna go with deeper palpations on your right lower quadrant. Do you feel any pain?
No.
Okay, your right upper quadrant, do you feel any pain?
No.
Okay, your left upper, do you feel any pain?
No.
Okay, your left lower, do you feel any pain?
No.
Okay, I don't see you grimacing either. That's a good thing. So there's nothing for me to be worried about. So I'm done with your abdomen now. You can just take your gown back. So now I'm gonna go to your legs. I'm gonna take off your socks. I'm sorry. Okay, so now I'm gonna listen to your popliteal arteries. I wanna be able to feel it, but as well, I'm also gonna check for strength and symmetry in both. Okay, I can hear them, so I'm gonna check for strength and symmetry. Okay, they're strong and symmetrical. I'm gonna do your posterior tibialis. I'm gonna check for strength and symmetry on both. They're strong and symmetrical. I'm gonna do your dorsalis pedis, your strength and symmetry. They're both strong and symmetrical. That's good. But I'm also gonna assess. I see a couple moles on your thighs. Have you had any problems before?
No.
Okay. I also see you have a scar on your knee. Have you ever had any issues so far?
No.
Has the healing been good?
Yeah.
Okay. Your temperature is good. I also see a big mole right here. Have you ever kept track of this one right here?
Yeah.
Has it been the same shape? Doesn't change, doesn't grow bigger or change in color?
And it's been the same.
Okay, that's good. Your temperature seems to be fine. I'm also checking for, do you feel any pain as I do this?
No.
Okay. I'm also checking for any signs of edema. I don't see any fluid overload. You don't have edema. Nothing at all there. So I'm also going to check if you have any moisture in between your toes. Don't notice any moisture in between your toes. That's good. I'm going to check for cup refill as well. Okay, it came back in less than 3 seconds. That's what I want to see. That shows your tissues are being perfused well. Okay, that's good. So now I'm gonna do a sharp and dull test on you. I'll have you close your eyes, and first, before I start, so this is sharp and this is dull. Okay. So I'm gonna have you tell me where I did pointed. Is it sharp or dull? Okay.
Sharp, right, shin.
Okay.
Dull, left, bottom of the foot.
Okay.
Sharp, right knee.
Mm-hmm.
Dull, right knee. Sharp, left thigh. Dull, right foot. Sharp, right thigh.
Okay. You got everything right. And do you ever like experience any pain in your foot, like, or wounds that take time to heal, like any neuropathies? None at all. Okay, that was good so far. Got all the 8 points on that. And you feel good? Do you feel good to get up?
Yeah.
Or do you feel any dizziness?
No.
Okay. I'm gonna have you get up now. Just gonna come back on the side of the bed. I'll help you close your gown for you. Okay, so now I'm just gonna have to do range of motion for your legs. Do you want to do cycle your legs inwards? Okay, outwards. Okay, I'm gonna push you up, pull me down, be like you're stepping down. Push me down. Okay, I'm gonna push you down, lift your legs up. Okay, can you just kick them out? In. Okay, your legs will be working fine. Now I'm gonna test for your patellar reflex. Close your eyes, please. Okay, that looks good. Okay, your patellar reflex is good as well. Your range of motion on your legs is fine. And you feel good standing up right now?
Yeah.
Okay, I'm gonna help you put your shoes on because you've been lying in bed for a while now. Okay, so for now, I'm gonna finish with my cranial of 8. That was for your ears, you could hear me well. But then I'm just gonna check for your equilibrium and balance because they all go together. And so I'm gonna have you stand. And that's your vestibulocochlear cranial nerve 8. So I'm gonna have you close your eyes, put your feet apart and your arms apart a bit. Then I'm gonna check that for 10 seconds. Okay, you can open them. That was just minimal swaying. I wouldn't be worried. You have a negative lumbar test. That's a good thing. So I'm gonna walk with you over that side. Just walk normally. Okay, turn around. Now you're gonna do your heel to toe for me. Okay, that seems to be working fine. If you can just sit down now. Your temperature throughout your body seems to be fine. I haven't noted any moisture or anything. You're not incontinent your activity level is good, you do exercise, you have a good balanced diet nutrition wise. So I would give you a Braden scale of 23, and that's a good score actually. And yeah, thank you so much for having me do this test on you today.